GLP secrets. This is everything. Every secret you need to know when you're on a GLP. First of all, did you know how they work? They work 3 ways. 1, they tell your brain, you're not hungry, you're not craving, so you need to listen. 2, they slow down your digestion. That's where you get most of your side effects. So first of all, you need to eat to, I feel food in my stomach. Then you need to make sure you're not getting nauseous, because if you get nauseous, you need to tell your provider. Then you don't want to overeat, because if you're overeating, guess what? The food's going to sit in there and you're going to feel really miserable. Then what you need to do, worry about constipation. Prevent the constipation, people. Don't get constipated. Take your fiber. Take your pre and probiotic. You might even want to take magnesium. That is a fantastic idea, because all of those things are going to prevent the constipation. If you get constipated, then you can take Miralax. You want to save the Doculax for the really bad times. If you go more than 3-4 days, or if you ever get any kind of belly pain down in here, go to the emergency room. Don't wait. Okay. So now if you get diarrhea, that's a whole nother ballpark story. Go to your provider. Okay. Diarrhea is typically because you ate something you shouldn't have. But if you get nauseous, get Zofran or talk to your provider. If you ever have a question, guess what? Talk to the provider. Okay, what should you eat? This is always a good question. Guess what? It's protein. But let's talk about what you shouldn't eat first. Simple carbs. Never eat simple carbs, because you know what? When you eat the simple carbs, you look like this. Yeah, that's me. Guess what? I live this life with you guys. I don't ever want to look like her again. Yeah, 105 pounds, people. I live this life with you all the time, every single day. I've helped thousands of people, just like you, just like me. We live it together. It's okay. I get it. Okay, so no simple carbs. Anything processed, white by man. I keep everything extremely simple for a reason. Because when it gets complex, we don't want to do it anymore. So simple carbs, man touched it. Don't eat it. Especially when you're first starting, because these might make you sick when you eat them. So don't eat them. Okay, then what you do want to eat, 25% of your diet comes from the earth. That is complex carbs. We want those. They give us energy. They make us feel good. Guess what? They help our belly, and that's a good thing. So we want those things. Then what we also want is protein. Women need 100 to 120 grams usually. Guys, about 120 to 150. If you want to get complicated, get one of those scales that tells you how much muscle you have. Every pound of muscle is a gram of protein. That is the complicated way to figure it out. So that's the good way to do it. Okay, 75% of our life is protein. I tell people stay away from the fruit, because fruit has a lot of sugar in it. So don't eat it. It's not good for us. You can have it every now and then. I get it. It tastes good. I understand that. So no simple carbs. We want our complex carbs. We want our protein. That's it. Okay, where do we do it? I tend to like the belly. You can do the outer thigh. Okay, you can do the back of the arm. If you need more specific details, talk to your provider. All right, now let's talk about the stall. That is going to depend on where your BMR is. The BMR is, you get one of those fancy scales again, and it's going to tell your BMR. We typically do 200 to 300 less than what your BMR is. Never less than 1200. Never, ever, 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 ever. Okay? Never go less than 1200. Women typically 13 to 1400. Guys typically 16 to 1800. Now, that's not always that number. That's a roundabout from all those thousands of people that I've seen. Okay, if you have any specific questions, you want a free consultation, reach out. Yes, this is me. This is what I do all the time. I am here for you, and I love to teach and educate and give you all this information. I am a nurse practitioner. My name is Angela. I actually do have a clinic. We can't help in all 50 states, but you don't have to order anything. I just want to make sure you're safe. I just want to make sure you have the information that you need. My team is here for you. Thank you. Have a fantastic day. Follow me. See you later.